Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of Aster. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented Aster's specialty. If you are Take charge of your health today by signing up for one of Aster's free online treatment programs. Just click the link on the screen. To become a patient or to purchase Aster tools, click the link on the screen. If you would like to become a certified Aster provider, click the link on the screen. Dermish, tell me what's going on.
Yeah, like 5 years back, I did a 10K run,
Okay.
and after that, I had small issues in Achilles tendon, and then hip was very tight. And then year after, like which is in 2016 mid, I had a major motor vehicle accident.
Okay.
After that,
So let's go back 1 second. Motor vehicle accident. What did you hit? What did you bruise?
so my car hit with the pickup truck like in a T.
Where did you hit your body in the car?
I didn't hit much. I was like pressed hard.
So you
hard.
did not hit your head.
No, I had whiplash. Yes.
And did you have any bruises from the seat belt?
No, no
Here's
bruises.
the questions.
No bruises.
Okay.
I didn't have even a neck pain,
Okay.
but I felt neck tightness after a couple of days.
Okay.
But I had a severe ankle pain on the top. Just for one day, I took one ibuprofen and pain went away.
Okay.
And then I continued playing tennis.
Okay.
For 3 months, 4 months, it was okay, but I started developing a lot of severe tightness in the hip, in the IT band, Achilles, calf, and then
So all on the left side.
yeah, and now I have like changed like 20 pairs of shoes. I always feel that these shoes on the left side are tight compared to the right
This
side.
shoes is tight, so you
Yeah.
feel like there's more inflammation on the left side.
Yes.
Okay. How much pain and tightness hip, back, and knee?
So when after playing tennis, it goes up to 8 out of 10.
Okay. What about? Do you have constant?
It stays like that for 2 days and then it tapers down. So it's like on and off. And when I'm not doing anything, like just on a daily basis, I go for walk regularly, like 45 minutes. And at the end of the walk, pain goes up to 6.
Okay. Do you have feel pain now?
Right now, yeah, I feel like it's not a severe pain, but I would say 4 out of 10.
How we
It is
aggravate it without walking? If we have you like squats or what we can do here, or sit to stand, can we aggravate it this way?
Maybe yeah, like doing jumping jacks probably might be like that.
And tell me how much pain from 0 to 10. Okay. Let me know.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16.
Stop by the 20. Yeah.
Yeah, right now
0 to 10.
I would say still 4. It hasn't increased much yet.
Let's do squats.
1,
Can you do 10?
3,
You hear
4,
that sound?
Yes.
Yeah, lots of clicking.
Where do you feel it?
I feel more here
How much?
on the side. Here I will say 5 out of 10.
Mm-hmm.
Here also 5 to 6 out of 10.
Okay, ankle.
Ankle, yes. Ankle always, it's constant. It's there no matter what I do.
So I did my subjective and objective, the function assessment, and that's what you can document afterward. So it's all in the left side.
All on the left side. And
Okay.
it also radiates now. Like I have shoulder issues too.
Mm-hmm.
So chain reaction.
So you feel it is going up to here?
Yeah,
Now?
after, yeah, not now. But after playing tennis, yes.
Okay. So we'll have you line yourself in there. Please measure your glasses, please. So you are a physical therapist. What kind of treatment you had here before coming?
I have been to an osteopath, chiropractor, physiotherapist, massage therapist.
Uh-huh.
And I found a temporary relief, but it comes back.
Okay. So basically you tried everything, yeah? Is that correct?
Yeah, pretty much everything.
You want to feel it?
Yeah.
I can see the muscle.
Mhm. And in here. And you can feel it in here.
Yeah, I can see that.
You can see it visually. Yeah, of course you can see it. The tightness that's gonna pull from his scapula down. That's latissimus dorsi and paraspinous. Yeah, so you can see. So objectively, how big is the scar?
Like 4 inches.
Yeah, you can see that. Remember day 5?
Right.
Yes. And the question you asked before, I will answer it. Answer it. Okay. And now we rest. How's it feel?
It's just the pressure, I guess.
Okay. Just want to make sure you're still awake, okay?
Yeah.
Oh, my goodness here, what's going on?
And that's for a long time. I asked my doctor, he says nothing more, it's just a skin change.
Mm-hmm. So I scanned all the area. How's that?
That's just like on the hamstring, yes, it's tight.
But it's not painful, yeah?
No.
Okay. So this way, he said it's in pain.
Yeah, that's
I really don't exert a lot of energy. Like physically is not really demanding on my part. I'm like just working smart, not hard, you know. How's that?
my pain, I think that's a different kind of pain.
So, well, it's either pressure, feeling, or pain. If pain, it's pain.
Right.
If you feel like pressure, yes, it's part of the treatment. You have to feel pressure. That's part of the treatment. It's normal to feel pressure. But if it starts to have the nociceptors and you start to have that painful signal,
They should tell
that's, yeah, and you should avoid that so you don't cause inflammation. So yeah, the difference, it's either pressure or pain. You know? Any question you guys have? Or it's, you get the hang of it, the sequence and routine? There you go.
Now?
Yeah, how is the constant pain now? Stand up and just move around and tell me how it feels. In the back.
Fine, the tightness is less here now.
You still feel tightness or it's gone?
No, it's less. I would say
How much from 0 to 10?
it's 2 now.
Where?
Like on this here.
Okay,
And here I would say only 1.
okay. What should I do next? Okay, I understand. Proliferation and inflammation in the same spot. Let's use this one. It's right in here, yeah. Okay. And this is easy. If someone has really severe inflammation, you can give it to the patient and they just put it in underwear or wrap around it. For female, like in the bra, you know, they can stick it in. We can do with him the same thing. Have them do it first. If there's no issue, it's fine. If not, we'll do the motion with the magna heel. Okay, how's the constant pain now?
And here it's gone, I think.
Okay.
There's no tightness right now.
Okay. What about the shoulder? Like that?
Like here also I would say it's 0. There's nothing.
Okay. Let's drink a little bit more water. Put your shoes on, socks on. We're gonna retest the function.
2, 3, 4, 5,
How much we did before?
7, 20.
I think 24.
How's that?
Yeah, I think right now there is no tightness or pain when I did that.
Okay, so let's do the squats.
1, 2, 3, 4, 5, 6, 7, 8, 9.
So in squat, I think I just feel more on the here.
Tightness or?
Yeah.
Mm-hmm.
I would say 2 out of 10.
Mm-hmm.
Pain wise, there's nothing much here right now.
Okay, we did not use a Magna Heel on that spot, so let's have you have a seat. Yes. And I really let you feel it. So, any questions? So basically, we'll know how, if he's ready to do some of those motions in the quad.
I think that's just from the workout. I think I'm feeling that.
It's just a workout for soreness, okay?
7, 8, 9.
But that
Okay.
click is always there.
Well, that's a different issue, but
Everywhere, like shoulder also.
clicking everywhere. So how do you feel?
I definitely feel like much relief in my left side back,
Mm-hmm.
hip,
Mm-hmm.
and then like back of the hamstring.
Mm-hmm. Okay. So you're a PT, you had everything before, like what you said you had, like massage,
Massage therapy,
acupuncture,
chiropractor, osteopath, physiotherapy
Mm-hmm.
by myself and by other physios. I think this is certainly long lasting and
Just finish the whole program with
Exactly.
yourself, you know, to get to the total recovery.
Yeah.
Yeah, awesome, awesome. Thank you.
thank you.